Yesterday, we spoke to Territory women who are seriously concerned about the ending of private maternity services at the Darwin Hospital, the Darwin Private Hospital. Now, the hospital announced the closure of its maternity ward by June 6 this year. The organisers of a petition opposing the closure say that the decision, which was made by the private operator, Healthscope, is going to leave expectant mothers and families across the Northern Territory without a choice of how they can access maternity care. Now, they say it's more than a healthcare shift. It is a blow to women's rights, family planning and the future of Darwin as a livable city. The Health Minister, Steve Edgington, joins me in the studio. Good morning to you, Minister.
Good morning, Katie, and good morning to all the listeners.
Good to have you on the show. I know we've got so many questions from Northern Territory women. So first off, I'll ask, these services at Darwin Private Hospital, they're set to end in June. Where are things at with the planning for that changeover?
Katie, firstly I want to reassure all expectant mothers that there's been a huge amount of work going on through NT Health, and what I want to reassure all expectant mothers and families is that these packages that I've spoken previously about, the luxury postnatal maternity retreat in a Darwin boutique hotel, but also the returning home sooner package, all of those are ready to be confirmed. And when I say ready to be confirmed, what I'm getting at is that NT Health has had ongoing conversations with the health insurers. So when we talk about them, Medibank, Bupa, the Australian Health Service Alliance have already reassured NT Health that these packages are insurable.
So, Minister, which hotel is it going to be? Where are women going to be able to stay?
Yeah, I can't announce that yet, but the conversations that I've had with NT Health, my understanding and talking about this is that we should be in a position by next week to announce where this hotel will be. There's been a lot of procurement processes going on in the background. These are the things that are commercially in confidence until we can announce them. So the conversations...
But it is definitely still happening. Now, in terms of the 24/7 maternity support, whether women are going to this postnatal maternity retreat or whether they're going home, what exactly is that going to entail?
So that will entail having the option. Now, let's make it clear that women aren't being sent off to this retreat. They'll need to stay in hospital if there's medical concerns about the mother or the baby. So moving somebody to, or giving the option of a private health patient going to this facility, that's a choice for that mother. So that will involve 24-hour services and 24/7
So what will that look like? Is it going to be a nurse able to care, like able to check on those women 24/7, or is it going to be over a phone line? What's it going to look like?
What it will involve is a planned scheduled visits by the midwife. And as we move forward, what we're hoping to have in place is a private arrangement where we can have midwives through a private arrangement, insurable process where midwives can go and attend that hospital. But in the meantime, we already have a domiciliary care midwives that go to homes every day of the week. So that will continue.
What happens for those women if something happens outside of those planned scheduled visits? Because what they were saying yesterday on the show and what they've raised with me is that is there a 24/7 phone line that they can call? Is there somebody that's going to be available should an emergency arise? All of those things that you would usually have if you were at a hospital or if you were staying at the private hospital for 7 days post-birth.
All of those options are available. There'll certainly be phone contact with a midwife. We have midwives on 24 hours a day, 7 days a week.
So that's a definite?
That's a definite. They'll be able to contact a midwife and have that conversation with a midwife. What we will have is planned visits to visit the mother and baby in that private luxury retreat.
Now, one of the expectant mums got in contact with us yesterday and said, Katie, I am being told that if there is a visit required outside of the planned visits, or if there is assistance required outside of those planned visits, then I'm either going to have to contact my GP or I'm going to have to present to the emergency ward at the hospital. Is that correct?
There's a whole range of options available, and that's the 24/7 contact with a midwife. There will be patients that have ongoing contact with their GP or their obstetrician. What we if there was an emergency, and this could happen anywhere, not just in a private luxury retreat, of course St John's are available 24/7.
Yeah, I guess so. That's a very different scenario to what women going through the private system would be receiving at the moment. So if you're in that private system, the majority of people I know that have had their bubs there, you'll be in hospital for 7 days afterwards, maybe a little bit less if everything's good and you're able to leave sooner, maybe a little bit longer if you've had to have an emergency caesarean or if you've wound up with preeclampsia or some other condition that preeclampsia is obviously but if you wind up with another condition, that means that you're going to need care for longer. Now, I get what you're saying, that they're going to be able to say stay in the public hospital for longer if required. But what happens for those women that maybe choose to go to the postnatal maternity retreat and then something does happen while they're in there? They can obviously call that 24-hour service, but is somebody going to be able to come out to them if that's what's needed?
The midwife, as I said, we already have the domiciliary care midwives in play now. They visit homes on a regular basis to work with families, work with mothers and the baby.
Yeah.
So that service will continue.
And if an emergency arises?
If an emergency arises, like any emergency, that midwife will make the decisions that are needed in consultation with the mother.
All right, Minister, I want to take you through a couple of calls that we had yesterday from 2 expectant mums. First off, let's take a listen to what Jess had to say on the show.
About the unsafe births happening at the public hospital. I think, the biggest concern is that we've got NT government saying that everything's safe, everything's fine, nothing to see here, and yet we're still hearing about these things. And it isn't just about the births, it's about women not being able to receive any kind of care in the lead up to their births as well.
So that is Jess on the show yesterday. I want to ask you, are there women that are giving birth in the halls currently at Royal Darwin Hospital?
Certainly not, and I want to reassure listeners that mothers aren't giving birth in the corridors of the Royal Darwin Hospital. What we have is around about 70 midwives and 13 obstetricians working through not only in the maternity ward, but there's other support staff there as well. We do know that mothers will arrive at the hospital at various stages of labour, but there's...
So there might be women labouring in the halls?
There's no doubt that that's a strong possibility. Women arrive at the hospital at various stages in labour. What I can reassure from the information that I have is that no babies have been born in the corridor of the Royal Darwin Hospital.
Minister, are we in a situation where we're going to have enough staff at Darwin Private Hospital to deal with the increase that we are expecting as a result of women no longer being able to give birth at the private hospital?
Look, the information that I have is that around about 2,000 babies a year are born at the Royal Darwin Hospital, leading up to the closure of the private hospital here in Darwin. What we've been told is that there's around about 250 babies born every year in the private hospital. The increase for the Royal Darwin Hospital can be absorbed. We're talking about a 10 to 15% increase in the number of babies being born in Darwin. I've been reassured that the system can cope with a 10 to 15% increase. And in fact, what it's actually taking back to is pre-COVID. These are the numbers that we're actually dealing with through the Royal Darwin Hospital.
We spoke to 𝙄𝙣𝙩𝙚𝙬 yesterday from the Nursing and Midwifery Union. She says that there is going to be additional staff required. She said that it is obviously going to mean, that it is additional work for the nurses and midwives at the Royal Darwin Hospital. So is there going to be any additional funding for Royal Darwin Hospital to cope with that?
What we're working through at the moment is, if we look at the staffing issues first, as I said, we've got around about 70 midwives working at the Royal Darwin Hospital. Are there enough staff across the board? What we do know is that there's a shortage of midwives and nurses right across not only Australia but globally. So there's always that case where there may be a shortage of staff. What we're constantly doing is recruiting to those positions, and we are offering opportunities for midwives currently working through the Darwin Private Hospital to come over to the public hospital. So those conversations are ongoing and those opportunities will arise.
All right, Minister, I want to take you to a call that we received yesterday from Tessa, another expectant mum. Take a listen to what she had to say.
I'm going to be a guinea pig for the new proposed private packages. And from the information I have from NT Health, a lot of what they have been talking about is not going to be in place for June. They're still obviously working through a lot of that, trying to get resources, and sort of to hear over the last few days that the opportunity has been there for the government to approach the federal government for some additional funding, and they haven't taken that up. I mean, this issue was alive well before the federal government went into caretaker mode. So when the minister says, we've approached them now, but we couldn't because it was in caretaker mode, the announcement was made in February. The Health Department and the minister have known that this is coming since September last year.
Minister, what do you say to that?
Well, there's been ongoing conversations, Katie. So having written to the federal minister, let me just go back a step. There has been ongoing conversations between Northern Territory Health and the Federal Health Department. Those conversations have been specifically around how can we improve the infrastructure at the Darwin Hospital. So those conversations have been going on well before the election. In fact, those conversations started back in February. There has been a submission sent to the Federal Department of Health back in March. So all of that, one of those submissions involves a proposal for $35 million to perform substantial upgrades to ensure a co-location of services and to improve the overall makeup of the maternity ward at the Royal Darwin Hospital. There has been a second option of $10 million, but
what's the second option entail?
Well, the second option is a smaller one, but that would only allow for minor new works to maximise patient flow, upgraded furniture and some more aesthetics type of improvement. So the $35 million is what we've proposed to the federal department. That proposal was made back in March. Look,
why though? I mean, you've known about this since the end of last year, haven't you? Yep. So why only that proposal in March? So
let's, if we just take a step back, last year we were told of the possibility that the maternity ward would close at the Darwin Private Hospital.
So why not at that point start going, okay, we need to prepare here?
We weren't given a date last year. We got a date earlier this year, and I think the first date was a closure around April. That's now been extended to June the 6th. We do know that those services will come to an end. So what we have done is had those ongoing conversations with the federal department. We're
still nowhere, and it's closing June 6th.
We're talking about infrastructure upgrades. Infrastructure upgrades aren't going to happen overnight. What we have been doing in the meantime is ensuring that we've been working with the private insurers to make sure that the services are available.
I actually think we're talking about certainty for Territory women, and we're talking about certainty for women who are really very worried that come June that what you're proposing may not actually be in place. Can you guarantee, Tessa, for example, that these services are going to be in place come June, and that you might have a longer term plan, but right now they are going to receive the care that they require?
That's what I've previously said, Katie, is that we've spoken to the private healthcare insurers. They've confirmed that those packages are insurable. What I've said is that we will have an announcement next week on where that private hotel facility will be. In
terms of the $35 million that then has been requested, I mean, is there capacity here for the Department of Health to potentially take over the ward that was previously being utilised at the private hospital? I mean, the infrastructure's there in place. Is that a possibility?
Those options have been looked at by the department. We don't own that building. It's owned. I don't even know who owns that building, but it's not owned by an NT Health.
Okay.
What we've looked at is all the options, and the best option that we've come up with at this point is an additional $35 million from the federal government to assist with upgrading the maternity ward at the Royal Darwin Hospital.
So would that mean additional beds? What will it mean if you're able to get that?
What it would create is additional facilities to address the most complex neonatal cases, even to assist with bereaved parents. So there's a whole range of upgrades that are needed. it would be better access to clinical management, but it would also give us larger rooms, more rooms, and have the ability to extend those maternity services further than what we have at the moment.
All right, Minister, I had planned to ask you about mental health and also about 𝙑𝙬𝙧, but we are being slammed by expectant mums sending messages through, so I might get through a couple of those if that's okay. I've got one here that says, "Good morning, Katie. Can you please ask the Minister what arrangements are in place for mums who have a C-section, given they're going to likely have to remain in hospital for a few days? Their birth experience, therefore, is going to be a public one. It sounds like they're just offering a hotel stay for aftercare, which I can't see many people actually wanting to take up," says that text.
When it comes to C-sections, these are things that I don't have the technical or the medical experience to talk about, but what I can say is that C-sections, as I said, we have over 2,000 babies born at the Royal Darwin Hospital every year. We have the expertise through midwives and obstetricians that deal with these things on a daily basis. If somebody goes in and has a C-section, they'll be provided with the care and support to manage that mother.
Look, I can say I had both my children via C-section at Royal Darwin Hospital and received exceptional care, but I guess the question being asked by these mums who are paying thousands of dollars in private healthcare is, where are they going to have a bed?
There are beds at the hospital, and it's not an issue. We've previously spoken about allegations that babies have been born in the corridor. What I can assure people is that the care, the service, the midwives and the obstetricians at the hospital are doing an incredible job, and those that may go in for a C-section, they'll get the care and support that they need during that birth.
I would echo that. I think the nurses, the doctors, the midwives, everybody at the hospital does an exceptional job. But the worry here is that as we're going to see that increase, we are obviously going to have women who may have a more complicated birth, who were expecting that they were going to be able to go and have a private room somewhere else or have a private room at a hospital, who are no longer going to be able to do that despite the fact they're paying for it.
Look, Healthscope have decided to make a commercial decision to withdraw their maternity services here in Darwin. As an NT Health and as the Minister in the NT Health Department, we've been working very closely with the insurers to make sure that we have alternative packages available. It's as much as we would like to, we didn't make this decision, but what we are trying to do is make sure that every parent, every family has a good birthing experience at the Royal Darwin Hospital.
Now,
we can't replicate what the private provider was previously providing.
Now, look, another one here. Hi, Katie. People talking about the fast-tracking of jobs for the Darwin Private Hospital midwives to Royal Darwin Hospital, but how come they still haven't heard anything about this application? And the 4-week deadline is tomorrow. They're still left in the dark and have no updates at all. We're 3 weeks away, says that text.
The advice I have is that those conversations are ongoing, and certainly if there's midwives at the private hospital, I would encourage them to have those conversations with the public hospital. But my understanding is that those conversations are ongoing, and there will be opportunities for any midwife that wants to come over to the public system. Those opportunities will be there for that person.
Minister, another one here. I understand these packages are coming in, but will they be in effect by the time the closure happens?
Yes.
They most definitely will be.
Yes, and I'm, as I said previously, I'm hoping to have an announcement next week. I can confirm that the health insurers, the healthcare providers, have confirmed with NT Health that these packages are insurable. Next week we should have further news on where that luxury retreat will be.
Now, if you have been in those discussions with the federal government, why did Tasmania get the money and we still haven't?
Well, I'm not sure what Tasmania got there. I think it was $6 million.
Yep.
So what we've been doing is looking at what do we really need? Do we need money to continue a service? What we're looking at is an opportunity to improve the the experience for mothers at the Royal Darwin Hospital. The proposal we've put forward is for $35 million. You can't put those proposals together overnight. There's been a lot of work put in to assess what are the real needs at the Royal Darwin Hospital. We've put that in writing. There's been those discussions with the Federal Health Department. Now that the caretaker period is finished and we have a new federal government, I've now written to the Minister and hopefully we'll have some further conversations.
Did you drop the ball there in terms of timing? Should you have done that sooner?
No, there's been ongoing conversations with the departments, certainly during caretaker mode, which is 28 days. You simply can't have those conversations. The opportunity is now to confirm the conversations that have been going on between NT Health and the Federal Department, and hopefully we'll hear from the Federal Minister very shortly.
Minister, just really quickly before I let you go, in this petition that Territory families, that these Territory women and families have launched, they are asking for the government to act now. They want to launch a central information hub where people are able to get transparent, regularly updated online information. They want you to host a public forum so that you can explain to everybody exactly what's going on, and they want you to commit to finding a long-term solution. Are you prepared to enact those requests?
As I said previously, Katie, what I want to do is reassure all of those expectant mothers that we have created the website. There's a lot of information on that website now that is being run by NT Health that provides a whole range of updates and covers most of the issues that I've just spoken about. So all of that information is up on the website. That website...
Would you host a public forum with them?
I don't know how many there are altogether, but what I'd like to do, and I've encouraged people...
I reckon we got lots of them messaging this morning, Steve.
Look, I'm happy to meet with mothers, whether that needs to be done through a public forum. I've certainly encouraged any mothers that are concerned about what's happening to write directly to me at minister.edgington@nt.gov.au.
I used to go to a Tuesday early birds mothers group, I think it was called. I reckon we need a coffee with the health minister, soon to be mothers group, maybe.
Love to do that.
Well, it might be something that is worth doing, because it does sound as though these pregnant mums that are wanting to have babies, they've still got a lot of questions and they're really worried. You know, they're concerned because the birthing journey that they thought they were going to be on has changed. Now, I know that the staff at Royal Darwin Hospital do an incredible job and nobody is disputing that. But there are still so many mums that are feeling concerned. They're feeling, anxious. They're feeling worried that they're going to be guinea pigs as this transition changes over. So it might be worth, having a coffee with this group of mums.
It's something that I'm happy to consider, finding the time to do that. But I know it's important, and I want to reassure all expectant mothers that we are taking the action that we've said that we've been doing right as soon as we became aware of what's going on. As soon as we had a closure date, we've been working extremely hard to make sure that these packages are available. All of that information is now up on the website, and what I'll be encouraging NT Health to do is to make contact with those mothers. And we need to be careful, because we can only contact the mothers that HealthScope have been able to give information to. So
I reckon I'd be able to get a few of them organised for you.
If mothers want to share their information that's with the private provider, with NT Health, more than happy to speak to them.
Minister for Health, Steve Edgington, really appreciate your time. We'll get you on another time to talk about the mental health announcement and also Acacia. Thank you.
Thanks, Katie, and good morning to everyone.
As it stands, there is very little clarity still on what will be realised by the 30th of May, and that's causing a lot of anxiety and real panic amongst the expected mothers who, even 2 weeks after that date don't yet know where their care is going to be taking place. So it is still a really tense situation for the mothers involved and for the community, the families who are supporting those women, and also women who are anticipating that they might, start a family in the future in the Northern Territory.
So, Minister, do you have any more clarity on what services will be available?
Yes, Adam, and I do want to reassure expectant families that NT Health and myself have been working constantly on this issue for a number of months now. So, look, I'm expecting sometime next week that we should be in a position to announce the aftercare packages. There has been work going on for quite a number of months now in relation to that. So, those two options that we're about to offer is a go home package where we would support the mother at home, plus the luxury hotel package. So we're in the last stages of finalising that. So we'll have some answers on that in the morning. But what I want to do is reassure people that there has already been a commitment from the health providers, and those conversations with Medibank, Bupa and Australian Health Services have been very positive, and they've reassured us that those packages are insurable.
So the insurance companies will pay for those packages rather than the taxpayer paying for them?
Yes, they will. So those health insurers have confirmed with us that those packages are insurable, and we're very pleased to hear that. What we do need to do is just lock in where that luxury hotel aftercare service will be, and we should be in a position to announce that next week. But I do want to reassure expectant mothers that we have those packages in place. There is confirmation that they are insurable, and we're ready to move next week.
And it should be pointed out, of course, that this just isn't a situation in the Northern Territory. This is a situation for HealthScope, one of the major private health providers right across the country, where they have been withdrawing those maternity services, I think because they're just not, for their idea, they're not cost effective.
Well, look, over the last year or so, we've had feedback from... when I say over the last year, we were certainly made aware of their closure last year. But what we do know is that there has been a declining number of births at the private hospital here in Darwin. They've gone over the years from around about 900 now down to just over 200 births per year. So, look, HealthScope have made that decision. Are we happy with it? Of course we're not. We would prefer that there's options for expectant mothers here in the Northern Territory. What we are doing as a government is stepping in to make sure that we have packages available. We want to make sure that those expectant mothers have the experience that they've been looking for. We can't have that birth in the private hospital, but we're doing everything we can to support those families.
What's your information about the private hospital and HealthScope in general? Because they've reduced the number of beds, I think, to half. They've closed one of the wards there. They've now reducing or getting rid of their maternity services as well. HealthScope is owned by a Canadian company, I think, called Edgington, who are the ones saying there's not profit in this. We thought there was going to be profit in this. Is there the understanding I had that there was a number of different health insurers like Bupa who were considering buying HealthScope? Do you know any information about that? Where we're with that?
No, we haven't had any updates on that. Look, the conversations we've had with HealthScope, I should say, has really centred around the maternity services. They've given us no indication that any of the other services are at risk. And, of course, if HealthScope have any other thoughts about that, I would encourage them to come forward and speak to us as soon as possible.
Can you be confident, though, the extra demand, because there will be extra demand on the public system, can you be confident the extra demands will be looked after in terms of birthing in the public system?
Look, we've had those ongoing conversations. Roughly in the Northern Territory at Royal Darwin, there's just over 2,000 births per year. So increasing by just over 200. We're talking about a 10% to 15% increase in the number of births here in Darwin. Our position is that we think that that there's no problem absorbing those additional births in the hospital, but having those ongoing conversations, and we've heard that there has been offers of money from the federal government to Hobart, for example.
$6 million.
So we're looking at where the opportunities lie for us. And
have you asked the federal government for money?
Yes, I have. So straight after the election, I've now written to Mark Butler. But what I want to reassure some of the listeners is that there's been ongoing conversations between NT Health and the Federal Department of Health around how can we maximise opportunities for funding to improve the services overall. Yes, we can absorb the number of births, but there are opportunities to improve the facilities at the Darwin Hospital. So in the first instance, what we have asked for is around about $35 million.
Okay, $35 extra million.
Yep. So that $35 million is to improve the infrastructure, and that would be substantial upgrades to the maternity area to improve the size of rooms, all of those things to provide a better service for expectant mothers.
You know, expectant mums, the rumour mills can be big, and I know that they've been concerned that there's mums giving birth in the hallways of the birthing centre at RDH. Is that the case?
No, it's not. Look, I want to reassure expectant mothers out there that isn't the case. I've been reassured from NT Health. What we do know is that mothers arrive at the hospital at various stages of labour, but what I can confirm is that there hasn't been any births in the corridor. the midwives, the nurses, the staff, the obstetricians at the Royal Darwin Hospital are providing an amazing service and will continue to do so.
𝙤𝙬𝙧𝙬 is being rolled out. This is the system which got rolled out last year, and then particularly in accident emergency, they said no, this is not functioning. Can you explain to me? Surely there's other systems in the rest of the country that we could. Why do we have to bring up our own one? Surely there's other systems elsewhere we could have just bought or leased off somebody else.
Well, there's a long history behind 𝙤𝙬𝙧𝙬, and coming into government just last year, look, there's been substantial financial commitments already to 𝙤𝙬𝙧𝙬. I don't know the full history, but what we do know is that we do have the 𝙤𝙬𝙧𝙬 system. We're now in the final stages of finalising the implementation, I suppose we would call it, in regard to 𝙤𝙬𝙧𝙬. And look, at the moment, some of the final processes are happening in Alice Springs and Tennant Creek, and that rollout will be completed very soon. But what I've also been told is that at Royal Darwin Emergency and Palmerston Emergency, they're the only areas here in Darwin that aren't using 𝙤𝙬𝙧𝙬 at the moment. So some of the final testing is underway, and we'll see 𝙤𝙬𝙧𝙬 fully implemented very soon.
We do have Base in the Grass in another couple of weeks. Pill testing. We've seen that natrazine has been detected in the Northern Territory. This is 50 times more powerful than fentanyl. It has caused deaths elsewhere in the country. Would the government consider some type of pill testing ahead or on the day of Base in the Grass in a couple of weeks?
Look, in regard to Base in the Grass, pill testing has never been done at Base in the Grass. What I do want to reassure is that the conversations that we've had is that the organisers of Base in the Grass have security. They have staff available at those, and what we want to do is ensure that people aren't taking drugs into those venues and using drugs.
But they will be, right? That's a thing that happens. It's just a concern if there is dangerous pills now circulating in the community. Surely some pill testing might save lives.
Pill testing is not part of what we're doing at the moment. I would encourage anybody that is thinking of using drugs not to use drugs. At the moment, we'll have sufficient security there, and all of the normal resources and supports will be in place should any event occur.
Budget's next week. Any surprises?
Well, yesterday I was out at the Royal Darwin Hospital and announced $16 million for the new mental health ward out there, and that's a significant announcement. So that'll give us 24/7 coverage of staff in the new mental health facility.
And a much-needed facility.
It's a much-needed facility. It's 24 beds in that facility, but also probably in the next couple of months, we'll be in a position to finalise the announcement of the 32-bed ward going up at the Royal Darwin.
Adam Steer on ABC Radio Darwin and the ABC Listen app.